Okay, how many muscles you got?
600.
Okay, 600. What? How many types of muscle?
3.
What are they?
Involuntary, cardiac.
Keep it that simple. Voluntary, involuntary, and cardiac. Okay. What is this whole thing called?
Cranium.
It's called the cranium. The cranium is divided into two pieces: the skull and face. Thank you. What lobe?
Frontal.
Frontal lobe. What are the lobes on the top? Parietal lobes, left and right. Remember the autopsy when he took the skull cap off, okay, and he got the brain out and he showed you the lobes of the brain, same names. What are the lines on top called? Suture lines. What's the lobe in the very back? Occipital. What are the lobes on the sides?
Temporal.
Temporal. What are these?
Orbits.
What is your nose mostly made of?
Cartilage.
Cartilage. What are your cheekbones? Zygomas. Top jaw. Maxilla. Bottom jaw.
Mandible.
Mandible. What is this pyramid structure that's lateral right here? Mastoid. What is the skinny one medial to it? Styloid. What is the hole the spine comes through? Foramen magnum. Here's your cranium test. We're going to do it just like that. Okay? And if the bones overwhelm you, and the guys a lot of times they do, memorize it one section at a time. It makes it a lot more user-friendly. Okay? What are these? Clavicles. What is this whole bone from top to bottom?
Breastbone.
Breastbone. Top bone. Manubrium. Middle bone. Sternum. Bottom bone. And everybody doesn't have a xiphoid. So the xiphoid, and I don't care about processes. Okay? What is this landmark? Intercostal arch. Okay, what lines it?
Diaphragm.
Diaphragm. Is the diaphragm voluntary or involuntary?
Both.
Both. Good. How many ribs do you have?
12 pairs.
12 pair or 24. Bottom two are called floaters or false. How do they attach anteriorly to the breastbone?
Cartilage.
Cartilage. How do they attach posteriorly to the spine?
Bone.
One of those few places you have that bone-to-bone fusing. What are these?
Inner.
ICS. Intercostal spaces. Good. Upper arm bone.
Humerus.
Elbow. Olecranon. O-L-E-C-R-A-N-O-N. Olecranon. Anatomical position. Lateral bone.
Radius.
Medial bone.
Ulnar.
These are carpals. These are.
Metacarpal.
These are.
Phalanges.
In order. No tricks. No tricks. What is this whole cavity called?
Pelvis.
Pelvis, pelvic girdle, pelvic cavity. All correct. What is the top piece I'm rubbing? This is the iliac crest. When you go over the crest in the pelvis, the first bone is called the ilium. You go down the ilium, it is the ischium. Anteriorly, it's the pubis symphysis, symphysis pubis, or pubis. They're all correct if you say that. Posteriorly, it turns into your butt bone, and your butt bone is called the ischial tuberosity. Ischial tuberosity. You have an indentation on each side of your pelvis right here, and that is called the acetabulum. 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 What plugs into the acetabulum? The femoral head, the head of the femur. And that is a true ball and socket joint. Remember I told you I'm not big on joints. Joints are articulations where two bones meet. Okay, they could be dislocated, they could be fractured. Okay, we'll talk about that when we get into trauma. What is the largest bone in your body?
Femur.
What is the largest organ in your body?
Liver.
What is the largest organ of your body?
Skin.
What is the large lateral protrusion? Greater trochanter. Small medial protrusion. Lesser trochanter. Medical word for knee. Patella. Weight supporting bone of the lower leg. Tibia. Non-weight supporting bone. Fibula. Heel. Calcaneus. These are tarsals. These are
Phalanges.
in order. Okay? In order. No trick. Oops. Sorry, sir. I mean ma'am. Okay, what are your back plates called?
Scalpels.
Scapulas. Okay. How many vertebrae you got? 33. What is the first vertebrae called?
Atlas.
Atlas. What's the second vertebrae called?
Axis.
Axis. What's the first group of vertebrae? How many?
7.
7. Which is most dominant?
7.
How do you know?
Sticks out.
God, you got that big old knot right there. That gives us a reference point when we're checking for point tenderness or we find something abnormal in our patient assessment. Second group, thoracic. How many?
12.
Okay. Third group.
Lumbar.
How many? Good. Fourth group. How many? and they're also, last group, how many? And they're also fused. Okay, what's the only portion you can palpate for point tenderness? Posterior spinous process. Posterior spinous process. And remember, look at that curvature of the spine. There's a normal posture and curvature that you should have. Okay, most injuries are going to occur in cervical and lumbar. Why? You have no support here. Okay, you got lots of support right here, a lot of girth, right? Head's on top of the neck, chest and cavities on top of the lumbar area. So you get a lot of injuries right here. We do lifts and moves and good ergonomics of lifting and moving. We'll talk about a thing called kyphosis and lordosis. You're going to see those terms that you're going to have to define later. Kyphosis